Imagine you're just sitting in a chair.
Okay.
You're fully clothed. Maybe you have your headphones on, or you're just casually reading a book.
Sounds relaxing.
Right. But while you are just sitting there, simply turning the pages, your body is involuntarily performing 11,000 Kegel exercises.
Oh, wow.
And it is doing this in the span of exactly 28 minutes.
That's just an insane amount of mechanical stress.
It really is. Now, take that intense, almost like unfathomable mechanical workout, and imagine pairing it with an injection of your own highly concentrated blood plasma.
Right.
And this injection goes into, one of the most sensitive areas of your entire body.
Yeah, that sounds incredibly intense. Honestly, for a lot of people listening to this, it probably sounds like science fiction.
Or like extreme biohacking or something.
Exactly, extreme biohacking. But what you are describing is actually, it's sitting right at the absolute forefront of modern regenerative medicine. And it is sparking a really fascinating debate among researchers and clinicians.
Which is exactly why we are here. Welcome to today's deep dive. We are looking at a customized stack of your sources today.
And it is a very interesting stack.
It is. The material ranges from like these super enthusiastic clinical treatment protocols all the way to some highly critical peer-reviewed systematic reviews.
Right.
So our mission today is to answer one very specific question. How does combining the O-shot, which is platelet-rich plasma therapy, with high-intensity focused electromagnetic seat sessions, alter and optimize your neuromuscular recovery timeline?
Yeah, and to truly unpack how those two radically different therapies interact, we can't just look at the combined result.
Right. We have to pull them apart first.
Exactly. We have to deconstruct them individually. We need to look closely at, what the clinical marketing claims are promising you, and then aggressively compare that to what the hard, peer-reviewed science is actually observing when they put this tissue under a microscope.
So let's start with the sheer physical force being applied to the pelvic floor. Because if we want to understand the recovery timeline, we first have to understand what the body's actually recovering from.
Makes sense.
And this brings us to the HIFEM phenomenon. So HIFEM stands for High-Intensity Focused Electromagnetic Technology. The device we see constantly referenced across all your sources is the M-Cella chair.
Yeah, the M-Cella chair. And the physics of this chair is genuinely staggering.
Just the numbers alone are wild.
They really are. The chair itself generates a focused electromagnetic field with an intensity of up to 2.5 Tesla.
And to give you some context for that number, that is roughly the exact same magnetic strength as a clinical MRI machine at a hospital.
Exactly. But instead of scanning you, that field is focused directly upward from the seat, and it penetrates up to 10 centimeters deep into the pelvic floor tissue.
Which explains why patients don't even have to undress, right? Because the magnetic field just passes right through clothing.
Right, exactly.
But what that magnetic field actually does to the human tissue is just wild. The literature repeatedly uses this term, supramaximal contractions.
Yes, supramaximal.
Can you break down what is actually happening at the cellular level there?
Sure. So a supramaximal contraction means the muscle is being forced to contract at an intensity that completely bypasses your conscious ability.
So it's stronger than what I could do if I tried my hardest.
Exactly. It exceeds what you could ever achieve through voluntary effort. It completely bypasses your central and peripheral nervous system.
Wow.
The magnetic field directly stimulates the motor neurons that innervate those pelvic muscles. And the key here, the really important part, is the frequency.
Right, because it's so fast.
Right. It triggers those neurons at such a rapid, unrelenting pace that the muscle fibers physically do not have the time to relax between the stimuli.
It is basically like a master puppeteer yanking the strings of a puppet so fast that the puppet's arms never actually have a chance to drop back down to its sides.
That's a great way to picture it, yeah. The muscle is just locked in this state of extreme active tension.
And your sources include a really revealing in vivo porcine study to demonstrate what happens to tissue under that kind of stress, right?
Yeah, the Yorkshire pig study. Researchers applied this exact HIFEM treatment to the biceps femoris, the leg muscles of Yorkshire pigs.
Okay.
And when they later examined the tissue histology under a microscope, they reported significant structural changes.
Like what kind of changes?
They documented both fiber hypertrophy, which is the physical growth and thickening of existing muscle fibers, and hyperplasia.
Hyperplasia being the creation of entirely new muscle fibers, right?
Exactly. New muscle fibers.
Okay, but I'm stuck on the math here.
What do you mean?
Well, you are forcing a human muscle to fire 11,000 times past the point of exhaustion, in under half an hour.
Right.
If I went to the gym and somehow forced my bicep to contract 11,000 times with no rest, I would be in the emergency room.
Oh, absolutely.
I'd had severe tissue damage and debilitating pain. So why aren't these patients completely incapacitated the next day? How can the clinic brochures possibly claim there is zero downtime?
That is the exact paradox that caught the attention of the broader medical community. You are totally right to question the math there.
Because it just doesn't add up.
It doesn't. The clinical sources do note that patients report mild pelvic floor muscle fatigue for a day or two. Like, they feel like they had a tough workout.
Sure, mild fatigue.
But there's a complete lack of traditional muscle tearing. There is no severe delayed onset muscle soreness.
No DOMS at all?
Exactly, no DOMS. And that massive discrepancy between the mechanical force applied and the lack of physical damage brings us to a highly critical scientific review of what is genuinely happening inside this tissue.
Right. Enter Dr. Eric Swanson.
Yes, Dr. Swanson.
He authored a systematic review analyzing 14 different clinical studies on these electromagnetic body contouring treatments.
He did.
And his findings, they throw a massive bucket of cold water on the idea that these chairs are rapidly building huge, bulky layers of new muscle.
They really do. When Dr. Swanson aggregated and analyzed the imaging data across those 14 studies, a very skeptical picture emerged.
How skeptical?
Well, the mean increment in actual muscle thickness was only 2.2 millimeters.
Wait, 2.2 millimeters?
Yeah. And to contrast that, the mean reduction in the fat layer above the muscle was 5.5 millimeters.
2.2 millimeters. That is basically the thickness of a piece of cardboard.
Yeah.
Or like a nickel.
Yeah, it's tiny.
If they are subjecting the body to MRI-level magnetic fields for weeks, a cardboard-thick layer of muscle does not align with the claims of massive tissue growth.
It doesn't. And it gets even more revealing when you look at the ultrasound images taken immediately post-treatment.
Right, the ultrasound data.
Yeah, Dr. Swanson pointed out that the muscle layer appeared echolucent on the ultrasound scans.
Okay, let's pause on that word, because
Well,
that's important. What does echolucent actually mean in the context of an ultrasound?
Right, so an ultrasound uses sound waves to create an image. Echolucent means the tissue is allowing those sound waves to pass through very easily.
Okay.
And that typically shows up as a darker area on the scan. Fluid is highly echolucent.
Fluid.
Yes. A healthy, dense, newly built muscle fiber, on the other hand, should look more echodense because the sound waves bounce off the dense protein structures.
Ah, I see.
So finding an echolucent muscle layer right after extreme exercise is highly consistent with cellular edema. It means the tissue is simply swelling.
So it is just temporary fluid retention from all that stress.
Exactly.
It is like soaking a dry sponge in water so it temporarily looks huge and bulky versus actually manufacturing more physical sponge material.
That is a perfect way to visualize it, yeah. The muscle is swollen with fluid, not fundamentally rebuilt with new permanent protein structures.
Wow.
And your sources highlight a pretty glaring conflict of interest regarding the studies that did claim to find permanent physical growth.
Yes, the systematic review explicitly notes this. It says that almost all the studies reporting significant permanent physical muscle growth were authored by medical advisors or paid speakers for BTL Industries.
Right. And BTL Industries is the manufacturer of the Emcella device.
That is a pretty massive caveat.
It is. Furthermore, Dr. Swanson found an unexplained lack of a dose response.
What does that mean in this context?
Well, in pharmacology or physical therapy, a dose response means that if a treatment genuinely causes a physical change, doing more of the treatment should yield more of the change.
Oh, like taking 2 Advil works better than 1.
Exactly. But the data didn't show that here. Subjecting a patient to extra treatments didn't yield greater physical muscle thickness.
Okay, so if the physical muscle growth is barely the size of a piece of cardboard, and the bulk of what we are seeing is just temporary fluid swelling,
Right.
why are the clinical sources showing massive, undeniable improvements for patients dealing with severe urinary incontinence? Like, if they aren't building big muscles, why are they suddenly able to control their bladders again?
This is where we have to completely reframe how we think about recovery.
Okay.
The answer lies in the nervous system, not the muscle bulk. HIFEM is profoundly effective at neuromuscular training.
Neuromuscular.
Yes. Think of it less as a hardware upgrade and more as a critical software update.
A software update. I like that.
It is not packing on thick layers of new tissue like a bodybuilder. It is forcefully reteaching the brain and the pelvic floor muscles how to coordinate.
So it's about communication.
Exactly.
Right.
It wakes up neural pathways that had become dormant, disorganized, or weakened over time. It teaches them how to fire together and maintain resting tone durably.
A software update for the pelvic floor. That makes total sense.
Right.
But, a software update has limits.
True.
If your laptop has a physically cracked screen, updating the operating system won't fix the glass.
Exactly.
So if a patient has physically damaged connective tissue, maybe a torn mucosal lining or structural tearing from childbirth, a magnet that fires the nervous system isn't going to magically stitch that physical tissue back together.
Precisely. The magnet trains the nerve, but for structural tissue repair, the body requires biological building blocks.
Right.
A magnetic field cannot generate collagen out of thin air. It cannot build new blood vessels. And that biological necessity brings us to the second half of this regenerative protocol.
Okay, so if the electromagnetic energy is the neuromuscular software update, we need a biological hardware repair kit.
Exactly.
And this is where we look at the O shot.
Right. The O shot, which stands for orgasm shot, is a highly specific application of platelet-rich plasma, or PRP therapy.
Okay.
The clinical process is surprisingly straightforward, but the underlying biology is incredibly complex.
Walk me through the process first.
Sure. First, a small amount of the patient's own blood is drawn.
Just a standard blood draw.
Right. Then that vial of blood is placed in a centrifuge and spun down at high speeds to physically separate the red blood cells from the plasma.
And what you are left with after the centrifuge is this concentrated golden liquid, right? The platelet-rich plasma.
Exactly, the PRP. That plasma is then injected, usually after applying a topical numbing cream directly into the anterior vaginal wall and the clitoral area.
Okay, but how does that actually heal anything?
Well, the actual magic happens once those platelets are introduced back into the damaged tissue.
Because they're activated, right?
Yes. When injected, the platelets are activated. They essentially break open and release a massive cascade of powerful growth factors into the local environment.
Growth factors.
Yeah. We were talking about platelet-derived growth factor, transforming growth factor.
Vascular endothelial growth factor.
Yes, and epidermal growth factor. It's a whole cocktail of them.
So walk me through that cascade. What is a growth factor actually doing at the cellular level? Because, throwing medical terms around doesn't really explain how a tear actually heals.
Fair point. Think of growth factors as biological messengers.
Messengers.
Yes. When the platelets release them, these messengers bind to the receptors of local dormant stem cells and structural cells in the tissue. They essentially wake these cells up and hand them a blueprint. They command the local cells to drastically ramp up the production of mature collagen and elastin fibers.
So they're ordering the tissue to rebuild itself.
Exactly. And they also promote a process called angiogenesis.
Angiogenesis being the creation of entirely new blood vessels.
Yes. The body literally builds new vascular highways to bring a permanent increased supply of oxygen and nutrients to the previously damaged or thinning area.
Wow.
It even supports active nerve repair.
See, instead of just a temporary software fix, this is like injecting a biological 3D printer into the tissue.
I love that analogy.
It's like the 3D printer uses your own plasma as the ink to lay down new cellular scaffolding where the old structural support collapsed.
That's exactly what's happening biologically.
And the clinical applications listed in our sources for this are just wild. It is used to heal thinning mucosal linings. It is used to reverse the severe tissue stretching that happens post-childbirth. And the one that really stood out to me, it is actively used to treat chronic pain in women caused by failed surgical mesh implants.
Yeah, that specific application for surgical mesh pain highlights just how powerful local regeneration can be.
That's foreign material in the body.
It is, but the PRP reduces the chronic inflammation and actively heals the surrounding nerves that were aggravated by that foreign mesh material.
That's incredible.
It's incredibly versatile because it leverages the body's own localized healing mechanism.
I am looking at the timelines in the sources, though, and I do have to question the delay here.
The timeline?
Yeah, because if this is my own blood, my own biological 3D printer, and the tools are already inside my body, why do the clinical protocols say patients have to wait 3 to 4 months to see the peak results?
Right.
Like, shouldn't my body begin repairing itself instantly the moment those platelets are injected?
It is a very common expectation to want immediate results, especially when we are used to fast-acting pharmaceuticals.
Right, like taking an aspirin.
Exactly. But tissue regeneration is fundamentally constrained by biological speed limits.
Biological speed limits.
Yeah. When you inject the PRP, you are initiating that complex biological cascade we talked about. You will absolutely see some early improvements, though.
Like what?
Many women report increased natural lubrication or slight shifts in nerve sensation within 1 to 4 weeks.
But that's just because the initial inflammation and fluid shift provides some early relief.
Right. Yes, exactly. But the actual physical creation of new blood vessel networks, the angiogenesis and the architectural laying down of new mature collagen fibers, that just takes time.
Because the cells have to do the work.
Right. The cells have to physically divide, migrate, and build. That structural remodeling process simply cannot be rushed. It takes up to 4 months for that new tissue to fully mature and reach its peak strength.
Okay, so we have our two distinct tools on the table now.
We do.
We have the M-Cella chair, delivering intense electromagnetic neuromuscular training.
The software update.
The software update, right. And we have the O-Shot, delivering biological tissue regeneration, the hardware repair.
Yes.
So to answer the core question of today's deep dives, what happens to the recovery timeline when a clinic actually combines them?
Well, let's lay their individual timelines side by side first. A standard M-Cella protocol is a 3-week series. Usually that is 6 sessions in total, twice a week.
Okay, 3 weeks.
You get initial improvements during the series, but the full neuromuscular adaptation, the brain fully learning how to fire those muscles again, peaks at around 3 months post-series.
Got it. And on the other track, you have the O-Shot.
Right.
The blood draw and injection take maybe 30 minutes. The protocol requires you to abstain from intercourse or heavy exercise for about 24 to 48 hours, just to let the newly injected tissue settle.
Right. Very minimal downtime.
Then you get those early superficial results in 1 to 4 weeks. But the deep structural peak results take 3 to 4 months.
Exactly. And those results typically last 12 to 18 months before a maintenance booster is needed.
So when clinicians combine these therapies, what happens?
It profoundly alters the entire recovery landscape because it finally provides a comprehensive approach. M-Cella is actively rehabilitating the neurological and muscular pathways. It is restoring the strength and the rapid-fire coordination.
Yeah.
Meanwhile, the O-Shot is actively regenerating the physical tissue of the anterior vaginal wall, the actual structural tissue that is responsible for urethral support and sensory response.
So if we go back to our earlier analogy, it is like you are renovating an old, failing computer system.
Okay.
The M-Cella chair is the software developer coming in and completely rewriting the operating system so it stops crashing.
Love it.
But the O-Shot is the electrical engineer opening up the back of the machine and physically replacing the frayed wires and broken hardware so the machine can actually run the new software.
Yes, because neither modality can do the other's job.
Right.
A 2.5 Tesla magnet cannot build collagen.
No.
And an injection of concentrated platelets cannot teach your brain how to properly fire a pelvic muscle 11,000 times.
Which leads to the ultimate question.
Okay, hit me.
Since they both individually hit their absolute peak around the 3-month mark, does combining them actually speed up the clock?
Just speed it up.
Yeah, like if I do both, am I fully healed in 1 month instead of 3? Or does combining them just drastically raise the ceiling of how fully I can recover?
Based on the synthesis of all your sources, it definitively raises the ceiling.
It raises the ceiling.
Yes, it does not speed up the biological clock. As we discussed, collagen still takes time to grow, and motor neurons still take time to adapt to new firing patterns. You can't cheat biology.
Right. Those speed limits are still there.
Exactly. But by running these therapies on parallel 3-month tracks, you are achieving a systemic restoration.
A systemic restoration.
You are fixing both the structural integrity of the tissue and the functional control of the muscle simultaneously, rather than just masking a single symptom.
That is an incredible paradigm shift.
It really is.
If you are looking at these treatment options right now, you are looking at the ability to completely bypass the natural limits of voluntary exercise.
Yeah.
It is not just doing more Kegels at home. By combining the hardcore physics of intense electromagnetic fields with the innate biology of your own blood plasma, you are rewriting how the muscle functions while simultaneously regrowing the tissue that physically supports it.
And if we look closely at the long-term implications of these sources, I want to leave you with a final thought to mull over.
Okay.
We are now at a point in regenerative medicine where we can successfully use a patient's own concentrated plasma to heal chronic nerve pain from failed surgical mesh.
Which is still mind-blowing to me.
Right, and we can use targeted magnets to safely replicate 11,000 involuntary muscle contractions to restore bladder control.
Yeah.
So if we can achieve both structural and functional restoration completely non-invasively,
Wow.
how long until this combined biotech template replaces invasive internal pelvic surgeries entirely?
A future without scalpels.
Ex-
Imagine completely retiring the operating room in favor of a centrifuge and a magnetic chair.
It's entirely possible.
The idea that you can read a book while a machine rebuilds your nervous system and your own biological 3D printer rebuilds your tissue proves that the future of recovery is looking remarkably like science fiction.
It really is.
Thank you for joining us on this deep dive. Keep questioning the science behind the headlines, and we will catch you next time.